now. All right, and then hopefully you can see this presentation here that's very basic, but has some visual to go along with it. So hi, Dr. Francavilla here, and this is the information session about the Boutique Healthcare membership that is starting January 1st for the practice. So just going to kind of walk you through what this is, what's going on, and then open up to questions and answer some of the common questions I've been getting. So first, why am I doing this? So for the last 7 years, I've run Green Mountain Partners for Health, and I will continue to do so. And we've done a traditional insurance-based model, and I've been really proud of our ability to navigate and provide really high-level care within an insurance model. Most of my colleagues, when I've told them what I'm doing, are pretty shocked that I take insurance and aren't doing what most the young hip docs are doing, which is membership models. And, you know, over the past year and a half with the COVID pandemic, I've realized that I am really boxed in by what insurance wants us to do as doctors. And that, to be honest, insurance does not have your best interest at heart or my best interest at heart. So I really want to be there more for my patients. I think most of my patients know that I love what I do. I'm very committed to it. I love being a doctor and I love improving people's health. And I think I can do more for my patients. I don't think insurance is the way that I can do more. And so I want to start leveraging technology to be more accessible to my patients, improve care, and improve my interaction. I want my patients to have access to the type of care that I get and that my family gets. My own doctor actually launched this same model just a couple of months ago, which was probably the push I needed to say that, yeah, this really is the best way to deliver care. And there's actually a lot of companies moving into this space. So I keep getting ads for Forward here in Cherry Creek, which is, you know, I guess sort of a similar connection with your doctor. CrossFit Health is launching, you know, a whole program nationally where people can have more interaction with their doctors. Pretty much all the big companies, Amazon, Walmart, everyone is trying to figure out how to, you know, have doctors on demand for their patients. But at the end of the day, those are still big companies that are going to create all sorts of roadblocks and all sorts of rules on how to provide care. And I don't really think that that's ideal. So I want to keep that small practice feel, but be able to do more. So a couple of years ago, right before the pandemic, my husband got really suddenly and mysteriously ill, which was really scary for me as a doctor. And we took him to his family doctor, and he'd always thought this guy was really nice, and he was really, really nice. And we did a bunch of tests, and we didn't have any answers, and my husband was still sick. And I found myself calling every day, not getting any answers, not having any follow-up on what to do next. And I thought, oh my gosh, is this what patients go through? And I reached out to a colleague of mine who had a membership practice, had a lot of availability, and was able to get my husband all the tests he needed and coordinate care for many weeks while we tried to figure out why he was so sick. And it was really nice to have that support and have that access to a doctor. And I can't imagine how scary it is to go through all of that without being able to have that access and to not be able to get answers. And so I want to be able to leverage technology, leverage what we have to be able to be there for my patients at that sort of level. So what exactly do you get with this membership? Number one, you get me. So that is, you know, one of the things. As my patient practice has grown, I'm sometimes too busy to get people in quickly. They end up seeing my colleagues. They go to urgent cares, emergency rooms, see random doctors or nurse practitioners online. And I don't really think that that's ideal. I want to be there. I want to be the one seeing you whenever possible, or at least touching base with you. And so with this practice model, I'll be able to be more available and be more accessible so that, you know, you can actually see your family doctor when you have something going on. And, you know, the way that medicine is run is a really crazy business in a lot of ways. And in outpatient family medicine, we all get sort of paid the same amount from insurance, regardless of how much our patients like us, no matter how well we do, no matter how long we've been practicing. And that's kind of unlike any other business. I actually run a few other businesses, and most of the time, you know, demand determines your rate, but that's not how it works for medicine. And in fact, if I were to go work at a hospital, I'd probably get paid about twice as much from an insurance company, because I'd get to charge something called a facility fee for working inside of a hospital, even though I'm giving the exact same services. And when we're a private practice that is not part of a hospital, we don't get to charge that facility fee. So in some ways, this membership becomes sort of like the facility fee, where, you know, we're kind of making up for that difference and, you know, trying to kind of level the playing field a little bit while adding a whole level of service. So one of the things I have seen over the years is that patients don't like what insurance considers a annual exam. When my patients come in, they usually have a laundry list of things they want to talk about their physical. They want to know how they can optimize their health. And then, oh yeah, they want that checklist of preventive care that we actually consider your physical. So instead of fighting this and keep saying like your physical is just your physical, I'm going to embrace that. We're going to give you a really long appointment time. It's going to be 60 minutes so that you can ask all your questions. We can do all the things we need to keep you healthy. And then we can also focus on key areas like nutrition, exercise, sleep, substances, including screens and stress, and figure out how to level up your healthcare. And then in addition to that, we'll be using a Skin.io digital skin exam. This is super cool. So you have a full body photography with an iPad, and then we'll use computer technology to analyze your skin for any changing moles or lesions over time. And so that will really give us a great idea of if there's anything we need to be looking at, biopsying for concerns for skin cancer. And then we'll be doing the in-body composition test standard. Some of my patients have been doing this if they've worked with me in my weight loss program. And this gives us an idea of what your muscle mass and body fat is, which is much more precise than just a scale to figure out what is going on with your weight and your body composition. So that's kind of the way we're going to level up that annual exam. I'm also going to offer texting. So I've been experimenting with this with a few patients who've had urgent things going on. You know, just before this meeting, I was texting with someone who's in the hospital right now. And I think it's 2021. It's almost 2022. It makes a lot of sense to be able to have this sort of access. And I think people want this. This is why people are Google searching and on WebMD and going to urgent cares, because in the information age, people want answers more quickly. They don't want to wait a week for an appointment. They don't want to wait a month for an appointment. They want their concerns addressed. And especially in the era of COVID, like there's a lot more concerns. There's a lot of new information every day. So I have a great new app called Spruce where you can text or email. You'll be able to do that within the app or just through a simple text, and message me any time of day whenever you think of a question or is convenient for you. I'm going to look at it when I'm awake. I'm a bit of a night owl, so you might get a message back if you message me late at night. Otherwise, you'll get it during business hours within 4 to 5 hours is the plan. On the weekends, you might get a response, you might not. So if it's something that's an emergency, you're still going to have our on-call doctor here, which 1 in 4 times will be me. But if it's something that's not urgent, then you know that's something that you can go ahead and message, and I'll get back to you within a day or two. If it's a weekend, within a few hours during weekdays, so that you know we can avoid emergency rooms, urgent cares, and forgetting what you wanted to ask me until your next appointment, then you forget it again, which I hear patients tell me all the time too. This might also be something where like you run out of your medicine and, you know, it becomes this whole big thing. I know as my practice has gotten bigger, unfortunately, even though I try to keep it as small and personable as possible, you know, there's still that barrier of the front desk, leaving a message. And sometimes by the time there's all that phone tag, it's been a couple of days. If you text me, you know, I'm getting that, you know, right away. There's no phone tag, and we can get things addressed for you much more quickly. And then I think this is the part that I'm most excited about is sort of being more proactive. So in the insurance model, we really just wait for you to come to us, and then we see you and then we bill your insurance. And I think that a lot of times people fall through the cracks. So I have people who stop taking medicines, stop making progress, don't realize that they've been feeling crummy for a while, that they've regained weight, that their depression symptoms are back. I think that I can be more proactive on that. And so the texting app will give me the opportunity to just create a quick text to follow up with you that'll automatically send, you know, days or weeks after our appointment to check in on how you're doing. And then there's going to be another app that you can use where you can, you know, keep your weight logged, your blood pressure log, a bunch of different logs. And if I start to see that there's no log in there, we might reach out to you. Or if we're starting to see a trend that is not ideal, like weight going up or blood pressure going up or oxygen going down, then we'd be able to reach out to you a little more proactively and say, hey, something's going on with your numbers. How are you feeling? Is everything okay? So looking forward to being a lot more proactive with this system so that, you know, we're not just checking in once or twice a year and waiting until there's a problem. We're trying to find it sooner. So the program is $40 per month for the membership, $30 if there's a second adult in your household. That could be your partner, that could be a parent, that could be a child, and then $10 per month for dependent children in your household. There's not really an age cutoff for this. So if you're still footing that child's bill for their insurance or their school or wherever they're at in life, pretty flexible on who I am going to consider that dependent child. And then there's a 10% discount if you prepay for the year, if that is something that's a good fit for you. I do have a very small percentage of sort of free benefaction memberships. And you can go ahead and email us or reach out to us if you think you qualify for that. And not sure what our selection criteria is going to be for that, hoping the numbers will just work out and we'll have the right amount. But, you know, may have to ask for some more information for people who apply for that to make sure that, you know, we're giving that to people who it makes the most sense for. So this is the biggest question I've been getting is, so what about insurance? Well, at the end of the day, this is an add-on service, to be honest. So your insurance is still going to be there for what your insurance probably should be there for: emergencies, for sickness, for tests, for blood draws, and for any of the services that you sort of use clinically. So if we need to have an appointment, whether that's telehealth or in person, whether that's preventative or whether that's for something, you know, that's a health condition, those are all still going to be billed through insurance. But it's going to open up some flexibility to do some appointments that are much quicker. So I have some patients who are on chronic medications that we need to check in on frequently, say maybe a medication for depression or ADHD. And sometimes that check is pretty quick. You know, I feel bad for these patients for asking the same 5 questions every time, and they have the same 5 answers. And we do this, you know, every 3 months. Well, now maybe that's just a quick survey or a quick text to check in. If everything's good, everything's the same, we can just send those refills. We're, you know, skipping an appointment that really was an unnecessary insurance burden before, but now we can kind of utilize this platform for that. So that might be one example of a time that kind of just saves time, becomes more convenient. So essentially, again, this is an add-on to your insurance. It's increasing your accessibility. You're going to have that higher level physical that has some additional services. And then you have, you know, easy access to an expert physician who knows you and that hopefully you trust with your care and can get good answers from, without all the hoops that insurance makes you jump through in order to, you know, see a doctor. You may decide you want a different insurance plan to complement this sort of thing. So if you previously had a plan with a lower deductible because you knew you had frequent visits with me, you might choose a higher deductible if some of those visits can now be done virtually without that charge. But at the end of the day, for most people, you're still going to pick the insurance plan that makes the most sense for you, whether that's private insurance, Medicare, or TRICARE. And this is really an add-on to that, that service where you're getting something above and beyond. The only people who cannot sign up for this program are someone who has Colorado Medicaid. They do not allow us to charge anything above and beyond Medicaid. So those patients will still be able to get care at Green Mountain. They'll still be able to see me, but they won't have access to any of these additional services. All other patients are going to be asked to choose this program or to be reassigned to one of the other doctors in our practice. That wasn't 100% the way that I would have chosen to do this, but you hire lawyers for a reason, and they told me I was at risk for discrimination if I picked and choose who does the membership program. And so in some ways, this is just pulling a Band-Aid, and it's offering the level of care that that I want to offer to everyone, and just doing it all at once. So that's kind of the insurance spiel and sort of, you know, who can do what sort of spiel. So what do you need to do next? If you are ready to sign up, you can go ahead and click this link here. That takes care of everything for you. It's going to collect your payment information. If you want to transfer one of the other physicians in our office, maybe you've seen one of them before, or you know, are ready to do that, just let us know. We'll go ahead and get you linked up with them. We do have a new weight doctor, so you know, that is a very specialized service that I've offered. But Dr. Sherman has joined us, and she, you know, is going to be picking up for those patients. And then, you know, if you're not sure, we're going to open up to questions now. You can still send questions. And essentially, this is starting January 1st. So our goal is to kind of get most people to decide where they want to go by January 1st. I'm not going anywhere. I'm still here. So, you know, I know there's people who are going to need a little bit of a longer transition, that we're in the middle of working things up. I'm not disappearing, but by March 1st, you are really going to have to have committed to, you know, if you're doing this program, or unfortunately, if you're going to find another physician that's going to meet your needs better. So that is the summary, and I will go ahead and open up to questions. I think I answered some of the common ones I've been getting along the way. I think we just have one person live with us, no pressure. But if you had any questions, I'm happy to go ahead and answer those now.
I don't think I have any globally relevant questions.
Okay, we can definitely talk offline. I can stop recording in a second too. We can answer those. But again, the most common question, I've been getting is, how does this work with insurance? And essentially, it is an add-on. It's leveling up that care. Insurance does not have your best interest at heart. They don't have my best interest at heart. This is improving that doctor-patient relationship so that I can be more directly available and more proactive and leveling things up for you. And the other question I think I've been getting is sort of like, oh, so this is required. And I feel like maybe I'm not directly saying that because I kind of wish it wasn't the truth in some cases, but essentially, yes, it's going to either be this way or we will happily help you find another doctor at this practice or elsewhere that, is going to meet your needs to continue using insurance the way you have been doing. Feel free to reach out with additional questions. You can always email us and go from there. All right. Thank you guys for listening. And I'm really excited for this new journey. I really think this is going to be a way to better take care of my patients. And I hope that I'll be able to continue working with most of you.